Good day everyone, I am Julianne Marie Langit, and today we're going to tackle about Lesson 7, and it's all about risky behaviors of adolescents. According to the Youth of Nation Building Act of 1995, or RE 8044, which established the Philippine National Youth Commission, or NYC, youth in the Philippines are those aged 15 to 30. What is adolescence? Adolescence is a time when a person transitions from childhood to adulthood. Children entering adolescence go through a lot of changes like physical, intellectual, personality, and social developmental, which occurs on average earlier than in the past, marks the start of adolescence. Adolescence is one of the stages of human growth. Ideally, a human being grows through infancy, birth to 1 year. Early childhood, 1 to 6 years. Late childhood, 6 to 12 years. Adolescence, 12 to 20 years. Early adulthood, 20 to 40 years. Middle adulthood, 40 to 65 years old. Late adulthood, 65 years and up. However, the World Health Organization defines adolescents or teenagers as people in the age range of 10 to 19. Young people aged 10 to 14 years are defined as being their early adolescents, and those aged 15 to 19 and their late adolescents. Adolescence is the transitional stage from childhood to adulthood. Risk behaviors. Risk behaviors in adolescence such as alcohol intake, substance use, poor diet, physical inactivity, and unprotected sex are common. Ito naman talaga yung mga nakasanayan ngayon sa mga teenagers, diba? Yung alcohol intake, yung paggamit ng mga alcohols, then yung unprotected sex. Talagang common siya ngayon. Then, the frequency of many of these behaviors increases if ito siya magpadayon makasinati or makakuha ng mga teenagers ani is sa kanang maagang pagkamatay. So, mo ni siya through adolescence and can continue into adulthood with consequent morbidity and premature mortality. Morbidity, ito is yung mga magkasakit ang mga katawan, and then yung premature mortality, ito yung maagang pagkamatay. And then, majority of the youth mature successfully through adolescence without apparent long-term problems. The majority of adolescents nowadays will through adolescence with few long-term issues. Daghang mga issues ang mga youth nowadays. And then, all of adolescents should be considered at risk due to the prevalence of risk behaviors. The inherent development needs to adolescents and the various risk factors for their initiation and maintenance. Because of the frequency of risk behaviors, adolescents' fundamental development needs and the many risk factors for their beginning and maintenance, all adolescents should be regarded at risk. Risk-taking. Risk-taking is a normal part of adolescent development. Also, risk-taking is defined as participation and potentially help comprising activities with little understanding or in spite of an understanding of the possible negative consequences. Example of this risk include behaviors like substance use, speeding, unprotected sex, and texting while driving. Also, risk-taking, adolescent risk-taking is a natural aspect of growing up. Next is identified sexual risks that were found among the growing Filipino adolescents are as follows. 1 in every 3 people has had sexual experience. They also have sex at an early age. Sa mga lalaki is they have their first sex at 17.6 years old, while sa girls have their first sex at 18.1 years old. 1 in every 50 people had sex before the age of 15, and 1 in every 4 people had sex before the age of 18. 7 out of every 10 cases of first premarital intercourse are protected against unplanned pregnancy and sexually transmitted illnesses such as HIV/AIDS. Trouble signs among teens. Sexual promiscuity. This having or involving many sexual partners, or not restricted to one sexual partner or few sexual partners. Ito yung mga kasagaran na mga nasinati kahon sa mga kabatan-una ng kanang bisag kinsa ang mga gina-intercourse na mga partners or kanang mga uyab-uyab na kuanan nila sa karon mo ni kasagaran mga problema sa mga kabatan-unan. And then regular use of drugs and alcohol. Use and abuse of drugs and alcohol by teens is very common. Common siya karon and can have serious consequences. And the 15 to 25 years age range, 50% of deaths from accident, homicides, suicides are involved alcohol or drug abuse. Drugs and alcohol also contribute to physical and sexual aggression such as assault or rape, na makaano siya o nagagamit permi aning drugs or kanang nagainom permi alcohol, pwede siya maka-assault or maka-rape. And then next is repeated use of the law or school regulation. Kasagaran mo ni siya ang mga karon sa mga teenager, dili sila nagasunod sa mga patakaran sa mga school regulation. And then aggressive outbursts or impulsiveness. Mao ni siya karon ang mga kabatanunan karon is mga aggressive. And then deterioration in hygiene. One of the earliest indicators of mental illnesses is a lack of personal hygiene, such as failing to wash, use deodorant, change clothes, or brush one's teeth on a regular basis. Oppositional behavior, and then chronic lateness. Mo ni siya kasagaran karon sa mga problema sa mga kabatan-unan. And then falling asleep in class. This one, common kay siya sa mga estudyante na katong naga face to face pa, kanang nagatulog sa klase. It's because daghan kay sila mga extra mga movement or extra na mga gipangbuhat before sila nisulod sa klase. Mo nang maka-feel sila o kanang example po danis kanang gikan hangover and then eskwela pagkaugma. So maka-feel jud sila na makatulog jud sila sa classes because hangover sila gikan. And then changes in physical appearance. And now next is harmful practices. Harmful practices are persistent practices and behaviors that are grounded on discrimination on the basis of sex, gender, age, and the other grounds, as well as multiple and intersecting forms of discrimination that often involve violence and cause physical and psychological harm of suffering. Harmful practices are persistent acts and behavior based on discrimination on the basis of sex, gender, age, and other factors, as well as numerous intersecting types of discrimination that often involve violence and cause bodily, psychological pain or suffering. And now, to be continued to my co-reporters by Catherine Opo. Say there
Good day, everyone. By the way, I am Catherine Upong. I am the continuation of the Lesson 7. My topic is the 10 common drugs abused by young people and their effect. First is alcohol, marijuana, nicotine, Adderall, opioids, strangulars, spice, keto, hallucinogen, inhalants, and DXM. First is alcohol. The effect of alcohol abuse on teens is decreased inhibition, increased comfort in social situations, decreased feelings of worry and anxiety, decreased physical tension. Marijuana. The effects of using marijuana is euphoric high, reduced stress and worry, increased feelings of well-being and peace. Nicotine. The effects of nicotine is a short-lived rush, feeling of relaxation, improved energy. Adderall. The effects of Adderall is increased energy with decreased need for sleep, diminished appetite, and euphoric high. Oxycontin. The effect of oxycontin is confusion and reduced decision-making skills, slowed pulse and lower blood pressure, slowed respiration, poor coordination, lethargy, nausea and vomiting, chronic constipation. Tranquilizers. The effect of tranquilizers is decreased anxiety, reduced physical tension, increased drowsiness, poor coordination, confusion, slowed pulse and breathing. Spice or keto. The effects of spice is increased relaxation, changed sensory perception, restored sense of time. Hallucinogens. The effects of hallucinogens is higher body temperature, poor coordination, poor judgment, nausea, anxiety, depression, extreme paranoia, and other symptoms of psychosis. Inhalants. The effects of inhalants is confusion, lack coordination, euphoria, signs. Number 10 is dextromethorphan or DXM. The effect of DXM is nausea, brain damage from lack of oxygen, dumbness, reduced coordination. The tips of staying drug-free is learn to set smart goals, build habits to stay busy, sweat it out or exercise, cut out toxic relationship, utilize support system, practice positive self-talk, adapt a fit, walk away from stress. The summary of the drug abuse is drug use and addiction are preventable. Prevention program involving families, schools, communities, and the media may prevent or reduce drug use and addiction. These programs include education and outreach to help people understand the risks of drug use. Treatment for drug addiction include counseling, medicines, or both. Research shows that combining medicines with counseling gives most people the best chance of success. The counseling may be individual, family, and/or group therapy. It can help you understand why you got addicted, see how drugs change your behavior, learn how to deal with your problems so you won't go back to use drugs. Learn to avoid places, people, and situations where you might be tempted to use drugs. Medicine can help with the symptoms of withdrawal. For addiction to certain drugs, there are also medicines that can help you re-establish normal brain function and decrease your cravings. If you have a mental disorder, Along with an addiction, it is known as a dual diagnosis. It is important to treat both problems. This will increase your chance of success. If you have a severe addiction, you may need hospital-based or residential treatment. Residential treatment programs combine housing and treatment services. Thank you for listening and God bless.